Hey everyone, and welcome back for another deep dive with us. Today, we're going to be talking about something that I think is probably on a lot of people's minds, and that is, should I be screened for colorectal cancer?
It's a big question.
It is a big question.
Yeah, and to really get into it, we're going to be using a case study from Dr. I.D. Ockpember's book, The Medical Screening Dilemma. And he talks about this guy, Damian, who's really the picture of health. You know, it works out all the time. But there's a catch. His mom had colon cancer at a younger age.
Oh, that's interesting.
Yeah, so that really raises the question, should Damian be screened even if he feels totally fine?
Yeah, it's easy to think, if it ain't broke, don't fix it, right?
Right.
But when it comes to colorectal cancer, things can be kind of sneaky.
They can.
I was reading that it's the third most common cancer in the U.S.
Yeah, and actually the second biggest cancer killer.
Wow.
Which is pretty sobering when you think about it. And what's really wild is that Dr. Ockpember points out that 80 to 95% of these cancers actually start as polyps.
Polyps. Okay.
You probably heard that term.
Oh, yeah, for sure.
But did you know that 10% of polyps that are bigger than a centimeter can become cancerous within 10 years?
Okay. That's a statistic that makes you pay attention.
Right.
Suddenly, polyps don't sound so harmful.
Exactly.
Yeah.
And get this, by the time you hit 60,
Yeah.
there's a 40% chance you've already got these adenomas hanging out in there.
Oh, wow. Okay, so that's a pretty significant number of people.
Yeah.
So using Damian as our example, we've got this guy who's avoiding the dreaded rectal exam.
Right.
I mean, who wouldn't?
Of course.
But he's asking for a ton of other tests.
Yeah, and that's where the dilemma comes in. And it's something that Dr. Ockpember highlights really well in the book. It's not about screening everyone.
Right.
It's about being smart about it.
Right.
Figuring out who needs which screening when they need it.
Yeah, gotcha.
We're not all cookie cutter cases here.
That makes sense.
Yeah.
But even the gold standard, the colonoscopy can miss things.
Yeah.
So how do we know which test is worth it?
That's a great question. And it's where understanding your individual risk factors really comes into play. You know, everyone always talks about family history.
Oh, yeah.
Family history. Well, Dr. Ockpember actually breaks it down further.
Okay.
He says family history is just one of 3 main risk categories that you should be aware of.
Ooh, okay. You've got my attention.
Yeah.
What are the other 2 categories that we might be overlooking?
So on top of those specific risk factors, like your family history,
Okay.
especially if like a parent or sibling was diagnosed under 60, you've also got a history of polyps yourself,
Okay.
or conditions like ulcerative colitis. Those all bump up your risk. But then there are the rarer genetic syndromes, things like familial polyposis or HNPCC, which only make up about 6% of cases.
Okay.
But they're a big deal because they often come with a higher risk for other cancers too.
Right. So it's not just colon cancer we're talking about. It's other things too.
Exactly.
So if you fall into one of those categories, it's definitely time to have a conversation with your doctor.
Absolutely.
Yeah.
And then there's the third category, which is where most people fall, the sporadic cases.
Okay.
And this is where those screening recommendations get a bit trickier because you don't have the obvious red flags.
So thinking about Damian, he's young and healthy, but his mom had colon cancer relatively young.
Right.
Where would he fit into all of this?
That's a good question. He's in kind of a gray area.
Okay.
The standard recommendations might say to wait until 50, but his mom's diagnosis throws a wrench in things.
So it sounds like figuring out your individual risk is really the first step, even before we start talking about which tests to get.
Absolutely.
Okay.
Now, one of the most common screening tools you'll hear about is the Fecal Occult blood test, or FOBT.
Okay, time to talk about poop.
Yeah.
Not the most glamorous topic, but hey, it's important.
It's important.
So this test basically looks for hidden blood in your stool, right?
You got it. And it's not just a one and done kind of thing. You need multiple samples to get a really clear picture. And Dr. Ockpember points out a couple interesting things here.
Okay.
First, stuff like vitamin C in red meat can actually mess with the results.
Oh, really?
Yeah.
I never would have thought about that.
Yeah, it's not something people usually think about.
What else did he say about the FOBT?
Well, he talks about the difference between low sensitivity and high sensitivity FOBTs, which I think a lot of people find confusing.
Yeah, me too.
So a low sensitivity test like the Occult 2 only picks up about 37% of cancers, but has a high specificity of 98%.
Okay.
Meaning that it rarely gives false positives.
Gotcha.
Then you've got the high sensitivity tests like the Occult Sensa, which will find 79% of cancers. but the specificity drops to 87%,
Okay.
meaning more false alarms.
So with the high sensitivity test, you might catch more cancers, but you also might end up with more unnecessary anxiety and extra tests.
Exactly.
It's a trade-off.
It is a trade-off to consider,
For sure.
and that's a conversation you need to have with your doctor.
Right.
Yeah.
They can help you weigh the pros and cons based on your situation.
So back to Damian.
Yeah.
Let's say his doctor suggests an FOBT.
Okay.
Do you think that would be enough given his family history? Or is it time to bring out the big guns, the colonoscopy?
Well, that's where things get even more interesting. But before we jump into colonoscopies, let's talk about another screening option, the sigmoidoscopy.
Okay.
It's like the colonoscopy's less intimidating cousin.
I'm all ears. Tell me more about this cousin.
So with a sigmoidoscopy, they use a scope, but it only goes into the lower part of your colon, not the whole way like a colonoscopy.
Okay, that does sound a little less daunting.
Yeah.
But if it's not checking the whole colon, wouldn't it miss stuff?
It can, that's the trade-off.
Okay.
It might miss things higher up. Dr. Ockpember points out that it finds about 7 cancers and 60 large polyps for every 1,000 exams.
I'm not sure whether to be reassured by those numbers or not.
Yeah, it's hard to say.
It's still a pretty decent chance of finding something.
Right.
But let's say Damian's doctor is leaning towards a colonoscopy. Okay.
The supposed gold standard. What would Dr. Ockpember say about that?
Well, here's where Dr. Ockpember throws a curveball. He says even colonoscopies aren't perfect.
What?
They have about a 5% miss rate for cancers
Seriously?
and miss even more polyps,
Wow.
especially the smaller ones.
I thought colonoscopies were supposed to be like the most accurate test.
They are good,
Yeah.
but no test is foolproof.
Right.
And the data shows that those tiny polyps,
Okay.
the ones under 5 millimeters, are just really hard to catch, even with the best technology.
So even if Damian goes through with the colonoscopy,
Yeah,
there's still a chance they could miss something.
there is.
That's kind of unnerving.
It is a little bit, yeah.
What's a guy supposed to do?
That's the million-dollar question. And it leads us right into another point that Dr. Ockpember makes. The guidelines for when to start screening are all over the map.
Oh no.
Different organizations have different recommendations.
Yeah.
And it can feel like a maze. Yeah, it's enough to make your head spin. How are we supposed to make sense of it all?
Okay, let's break it down.
Okay.
First, you've got the U.S. Preventive Services Task Force, that's the USPSTF, a group that makes recommendations for doctors nationwide.
Gotcha.
They say average risk folks should start screening at 50
Okay.
and go until 75.
Okay.
And they're pretty chill about which test you pick.
Oh, okay.
FOBT, sigmoidoscopy, colonoscopy, they're all cool in their book.
So starting at 50 seems to be the general consensus, but I bet it's not that simple.
You know,
Yeah.
the American Cancer Society is on board with starting at 52, but they're more into the imaging tests like colonoscopy or CTC,
Okay.
because those can detect both polyps and cancer.
Ah, so there's a little more nuance to their recommendation.
There is.
What about the other big players?
Well, the American Gastroenterological Association is basically in line with the American Cancer Society on that 50-year starting point for average risk folks.
Okay.
But they get a lot more specific for people who are high risk. They might suggest starting earlier and getting screened more often, depending on your individual risk factors.
Okay, so even within these big organizations, there's some wiggle room depending on your situation.
Exactly.
Yeah.
And that's why blindly following guidelines isn't always the best approach.
Right.
You really need to factor in your own risk,
Sure.
your family history,
Yeah.
your preferences,
Okay,
all of that.
right. Like Damian's clearly not thrilled about the idea of a rectal exam.
Right.
So even if a colonoscopy is technically the best option, if he's not going to do it,
Yeah.
what's the point?
You're getting it.
Yeah.
Dr. Ockpember talks about this too.
Okay.
He says the best screening test is the one you'll actually do.
That's so true.
Compliance matters.
Yeah, I can totally see someone avoiding any screening at all
Oh, yeah.
just because they're dreading the prep or the procedure.
For sure.
Yeah.
So it's about finding that sweet spot
Okay.
between what's most effective and what you personally can handle.
So if I'm hearing you right, what you're saying is, even though we're learning about all these guidelines and recommendations,
Yes.
the most important thing is to have an open and honest conversation with your doctor.
You nailed it. No one should feel pressured into any specific test without understanding the risks and benefits.
Okay.
And Dr. Ockpember even goes into some detail about some potential downsides of each method.
Okay, let's talk about those.
Okay.
I know with the FOBT, we already mentioned the whole false positive, false negative thing.
Right.
But what about the sigmoidoscopy and colonoscopy? Those seem a bit more invasive, so I imagine there's more to consider there.
For sure. So with sigmoidoscopy, there's a slight risk of things like discomfort or complications.
Oh, okay.
Because you're still inserting a scope.
Right.
Dr. Akpamber cites a bowel perforation rate of about 4.6 per 100,000 examinations.
Wow. I had no idea there was even a risk of perforation.
It's rare,
Yeah.
but it's something to be aware of.
And what about the colonoscopy? What are the downsides there?
Well, since they usually sedate you for a colonoscopy,
Right.
there are potential complications from that.
Okay.
Again, serious issues are not common,
Mm-hmm.
but things like bleeding or bowel perforation can happen.
So even if you're opting for the most thorough test, there's still a tiny element of risk involved.
There is.
It's all about weighing those risks against the potential benefits of catching something early.
Absolutely.
Yeah.
And that's where having a good relationship with your doctor is key.
Yeah.
They can walk you through all of this, answer your questions, and help you make an informed decision that's right for you.
Okay, so bringing it back to Damian.
Okay.
The guy who's healthy, works out a ton, but has that family history.
Right.
Based on what we've learned from Dr. Akpamber's book, what should he do?
If we're just looking at the guidelines,
Yeah.
Damian's kind of a tough case.
Okay.
He's younger than the recommended starting age for average risk folks,
Mm-hmm.
but that family history is definitely a red flag.
So it's not a clear-cut answer.
Not really. Some experts would say he should start screening now, given that his mom was diagnosed at 54.
Okay.
Others might say to wait until he hits 50 and follow the standard recommendations.
So it sounds like he's in that gray area
Yeah,
where it really comes down to having a good conversation with his doctor and weighing all the factors.
exactly. And this is where I think Dr. Ockenbor's book is so valuable.
Okay.
He doesn't just throw a bunch of facts and figures at you.
Mm-hmm.
He really emphasizes the importance of shared decision-making
Okay.
between the patient and the doctor.
That makes a lot of sense. It shouldn't feel like the doctor's dictating what you should do. It
Right.
should be a collaborative process.
Exactly.
Yeah.
And remember, screening isn't a one-and-done kind of thing.
Right.
It's an ongoing conversation with your healthcare provider.
Right.
Your risk factors might change over time.
Yeah.
New tests might become available. Guidelines get updated.
Sure.
You need to stay informed and proactive.
This has been super helpful. I feel like I'm starting to understand all the nuances of colorectal cancer screening, but I have to ask,
Yeah.
for someone like me who's not a doctor or a medical expert, how do we even begin to navigate all of this information?
I hear you. It is a lot to digest.
Yeah.
And that's where resources like Dr. Akapimmer's book come in handy.
Yeah.
He does a fantastic job of breaking down complex medical concepts into language that everyday people can understand.
Okay.
He doesn't just present the facts. He
Yeah.
explains why they matter and what they mean for you.
It sounds like he's that friend who can explain things in a way that doesn't make your eyes glaze over.
Exactly.
Yeah.
And he also gives some really practical advice on how to talk to your doctor about these issues.
Okay.
It's like having a roadmap for that conversation.
That's so valuable because, let's be real, sometimes those doctor's appointments can feel rushed.
Oh, yeah.
And it's easy to forget your questions or get intimidated by all the medical jargon.
For sure.
Having a resource like this could help you feel more prepared and confident going in. Yeah.
So if anyone's listening to this thinking, okay, this is great information, but I'm still not sure what I should do,
Yeah.
what would be your advice to them?
My advice: pick up the phone and make that appointment. Don't wait until you have symptoms or you think something's wrong. Prevention is key when it comes to colorectal cancer, and early detection can literally be a lifesaver.
Couldn't agree more. Don't let fear or uncertainty hold you back.
Yeah,
Knowledge is power,
absolutely.
and having that conversation is the first step towards taking control of your health.
So true. And for those who want to dive even deeper after this, Dr. Akpamber's book, The Medical Screening Dilemma, is definitely worth checking out.
It is.
He covers so much more than we could even touch on today.
It's packed with insights and practical advice. I think anyone who wants to be a more informed advocate for their own health would benefit from reading it.
This has been such an eye-opening deep dive.
It has.
I feel like I learned so much about colorectal cancer and the whole screening process.
Me too. It's a topic that doesn't get enough attention, but it's so important to talk about it.
Yeah.
Openly and honestly.
To wrap things up, what's the one key message you want listeners to walk away with?
If you're even thinking about getting screened,
Yeah.
or if something feels off,
Yeah.
schedule that doctor's appointment.
Mm.
Don't put it off.
Yeah.
Early detection is the best weapon we have against colorectal cancer.
Couldn't agree more. It's all about being proactive and taking charge of our well-being. Thanks for joining us on this deep dive.
It's been a pleasure. Until next time, stay curious and stay healthy.